When we talk about electro, we need to understand a few points. I don't know what electro means to you. I don't know what level of electrocardiogram you're at, but I'm going to explain it to you at a basic level. So I suggest if you're a nurse that you master electrocardiogram, man. It's not something that sets you apart. It's not something that sets you apart. It's a basic thing you have to know. It's a basic thing, so I'm going to talk at a basic level here so you can follow along with me. Here, in a normal electrocardiogram, we have 12 leads, and these leads are usually in the printout configuration. I'm not talking about the one that's just a single strip, which it could be, but usually we have an electrocardiogram like this. Lead 1, lead 2, lead 3. Then here we have AVR, AVL, AVF. Then we have V1, V2, V3. V4, V5, V10, V6. This V looks like a U. So here's the thing. This is how it is. Here's the thing. It's a basic 12-lead electrocardiogram, remembering that in an electrocardiogram one can have up to 19 leads. I'm not going to talk about that now. This is basic. I'm not going advanced. So Einthoven, who is the guy who created the electrocardiogram, he created Einthoven's triangle. So he said, man, how can I see the muscular and electrical activity of the heart at the same time to know if everything is working? And then he divided this here into groups. So let's go first. The little boot, 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 boot. Hey, little boot, guys, pay attention, little boot, little butt, little boot, little butt of the heart. The apex here, look, the apex of the heart is the little butt. Lead, 2, 3, and AVF, 2, 3, and AVF without memorizing. You have to know the boot, what the little boot is, the little boot 2, 3, and AVF kind of form a little boot. This little boot is the little butt here of the heart. So this part here is the inferior wall. It's not lower, it's inferior. Look. The heart, here's the bottom part of the heart. This little butt here, look, is the inferior wall. So the inferior wall is this one right here. Okay, let's go. I'm going to get the black marker. Guys, this is really easy, man. Really easy. Look, lead 1 and leads V5 and V6 are in the same boat, man. It's basically the same thing. It just changes in height. This is left ventricle, that's it. It's over for lead 1, AVL, V5, and V6. It's the left ventricular wall. Forget about the right, man. Forget about the right. What's important is the left ventricle, left ventricle. Where is it? Here, look, the lower part is 2, 3, and AVF. On the side, lead 1 AVL, V5, and V6. Lead 1 AVL, V5, and V6. Okay, front wall, front wall. The front wall is the anterior wall. Which one is it? The anterior wall? Let me get the red marker here. Let's go. Look, V3 and V4. V3 and V4, man. V3 and V4. All right, little front wall, V3 and V4 and V1 and V2. What separates the ventricles is the septal wall, interventricular. Got it? Leave that, okay, leave that V1 and V2, so that little wall right there, see? Between the two ventricles, septal wall, okay, V3 and V4 little anterior wall, inferior wall 2, 3, and AVL, V3, AVF, right? Lateral wall V1 and AVL, V5 and V6. No memorizing, okay? Later you take this and practice, got it? You have to write this until you get tired of it, until your hand says, man, I can't write this anymore, okay? This is basic for any healthcare professional and nurse. So, man, it's your duty to know this, okay? You have to know the walls of the heart, all right? All right, well, I can't explain all of this in detail because we only have an hour to talk to you here. So, here's the thing. Pay attention to what I'm going to tell you. When we ask in the heart attack protocol to do an electrocardiogram within 10 minutes, what do I want or what am I looking for? It's simple. Let's do it here. Look, P wave as in pedo, duck. Here, look, QRS. And now look, just look. What happens there? I had an ST segment infarction. If it were normal, look, the dashed line is normal. The ST segment was supposed to be isoelectric. Here it was supposed to be QRS. So it was supposed to go from S to here. But what happened? It went over here. So I have the infarcted wall downwards. The electrical part is going down. It's pulling down. What does that mean? Man, this is really easy. It's really easy. Infra. Stick with me. Stick with me. Stick, 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 stick. Look, infra ischemia. Infra ischemia, all with I, infra ischemia. What happens is that infra means the guy hasn't had a heart attack yet. In other words, there's no necrosis. He's not at the worst moment. It's bad, man. It's not good in the infra, right? But he hasn't hit rock bottom yet, you know? And when we come here, pay attention here. Look, when we see this here and this here, look, let's go. What would be normal? So the S wave is positive, the ES wave is negative. It would be down here, come over here. Look, this was supposed to be normal like this, right? S wave down here, ST segment here, and the T wave for tattoo here. But what did I have? A positive S wave and not a negative one? So this here we call supra. The word superana, sovereign. It means the shit happened. The guy had a heart attack, and the supra on the electrocardiogram shows exactly where it happened. Heart attack. So let's go. So can I put supra here in necrosis? Can I? The guy has a supra, so he had an ischemic area or a place that died. Ah, Eder, let me see. So let me understand. The patient had a supra in V5 and V6. He had a heart attack in the left ventricle. The guy is in trouble. The guy had a supra in lead 2 and V3. He had a heart attack in the little bottom there, the apex of the heart. The guy had a supra in V3 and V4. The guy had a supra. He had an anterior wall heart attack. Did you get it? Did you understand the point? See that this thing isn't hard, that it's really easy? So this here will help you understand where the heart attack happened. Pay attention so you don't do it wrong. ST elevation localizes the heart attack. ST depression does not localize the heart attack either. Let me get this straight. So if the guy showed a depression in the little boot, it doesn't mean the little boot is... The heart attack is happening there. Perfect. It doesn't mean it's there. It means it's happening somewhere in the heart. A distress. Now, if the electrocardiogram shows elevation, it's over. It's that region you saw that's really infarcted, all right, guys. So here's the thing. ST depression, ischemia, does not localize the infarct. So in any of these leads you're seeing here, if you see ST segment depression, it means there's nothing good going on. But you don't know the exact region or location where the blockage is happening or could happen and the area that could die. If you already find a patient with ST elevation on the electrocardiogram, it means this guy has already had necrosis. And that's really the spot where he's having the heart attack. Okay, you're a nurse, right? Your nursing technician is the one who does the electrocardiogram, but you have to instruct your team very well. Whenever you do the electrocardiogram, ask them to call you right away. The patient arrives and is classified as having chest pain. Immediate electrocardiogram, tell the technician to do the electrocardiogram. Don't remove anything from the patient. Call me while the electrocardiogram is still running so I can see. You, as a level A nurse in the emergency room, man, do you have a different level of understanding? The technician already called you, Fulano, you asked to be called, come here. The electrocardiogram is almost ready. You get there, let's do a second electrocardiogram. Let's place V3 and V4R here. Then the technician says, look, I don't know. Okay, I'll help you. I'll teach you here. Did you get that? Is he a good nurse? A nurse who will be respected by the team? A nurse who will show leadership skills? That's when you say, man, I'm a nurse. Above average. It's about understanding that. In the protocol, it's not about following a rule without knowing the reason. Do you know why you asked him to wait? It's because if this guy has an abnormality, you have to do a second electrocardiogram with V3 and V4R. If you go to an emergency physician, preferably because the others unfortunately might not know, you go to an emergency physician and say this. Dr. Donna Maria arrived, I don't know, Mr. Jose, 56 years old with precordial pain. We opened protocols for chest pain. We did 2 ECGs, this is the first one, but in the first one he showed an elevation in V1. I asked for us to do a second electrocardiogram moving V3 and V4, placing them on the right side, making V3 and V4R. look, we had a change. Have you ever thought about what this doctor is going to think of you, man? What kind of nurse is this? She did 2 electrocardiogram S, which is what happens when the doctor is really good, the emergency doctor. When he looks at an electrocardiogram like this, he asks to repeat the electrocardiogram doing V3 and V4. The nurse doesn't know, the technician doesn't know, and the guy says, see, if it weren't for me here, things wouldn't work. But when there's a nurse above average together with their team, look at the level they already handed to the guy. Already, all set. The level you raise in the doctor's mind. Of respect, you have no idea. So if you want to be respected, valued, the first point is show incredible knowledge, and I can teach you. I'm here for that.